in collaboration with the St. Kitts Nevis Medical and Dental Association and ZIZ. We are coming to you again with another very interesting talk and discussion. To my new viewers, welcome, and to my returning viewers, welcome back. I have here with me Miss Nurse Nikisha Hazel of the Bathsdale Health Center. She's the Deputy Coordinator for Community Nursing. And our topic for this evening would be the risk and communication of the measles virus. I would like to take this opportunity now to welcome my guest, Miss Nurse Hazel. Hazel?
Hazel.
Hazel.
Thank you.
Nice to meet you, Miss Hazel. So, like I said, we're going to be speaking about the risk and communication of the measles virus. Reason being is because recently, even though the virus has been eradicated in the region since the early 90s, nurse?
1991, yes.
1991, we hadn't seen any cases of measles, but recently we've seen some foreign cases.
Yes, we've had recently 2 cases in Turks and Caicos. It has entered our region, the Caribbean, Latin America and the Caribbean region, and measles is something that we haven't seen for a very long time, and most of us as nurses and even, younger doctors have never seen a case of measles. So this is very, very important for us to get the word out there about what is going on as it relates to measles.
Interesting. I mean, I myself, as you said, I would be too young to have ever seen a case of measles, but from what I understand about it, it can be a very debilitating disease, especially I think it's a particular threat to the very old and the young, but of course anyone can get it. But for me, I'm always concerned about the babies and the old people. So we'll just get right into it. We can have our first slide, and I will have my expert nurse. My expert nurse would help me to help you guys understand what we're facing with measles.
All right, so measles is a very contagious disease. It's a virus, and it's spread very easily by just us speaking, coughing, and even singing. Yes, so it's an airborne disease, and it's extremely contagious.
Wow.
Yes.
Wow. So we're going to go through the incubation period and all of this. I'm going to open this on my own screen so that I can keep up. Just a minute. So that was the first slide. Will we be able to get the second slide?
So now it's talking about the spread of measles, which I mentioned earlier. So measles is spread through cough, persons coughing, kissing, touching surfaces where measles virus would have been. So as I said earlier, it's very contagious and it's airborne. So it can actually survive on the surface for up to 2 hours. So persons who may have been in an area probably left that area, and other persons who, enter that area would be, contaminated with the virus itself. And that is why it's important for us to remember hygiene, sanitizing the place, hand hygiene, especially hand hygiene, hand washing, whether you're using soap and water or you're using your sanitizer or something of that sort. That's going to kill the virus. So the virus is very easy to be killed also. So just by washing your hands using alcohol-based sanitizer or even wiping down with disinfectant can destroy the virus.
Okay, that's good to know, because the reason I was asking these questions is because it's an airborne disease. So, and it's not a flu. So even though it's an airborne disease, so then if I touch a surface and I'm sick, it's from my bodily fluids like sweat and all of these things, because it's not like a flu where I'll be coughing. It's not like COVID where we were concerned about persons not wearing masks and coughing. But with measles, since it's airborne, is it that someone with the virus should wear a mask too?
It's not a matter of wearing the mask, but even though wearing the mask can assist, but it's not a matter of you wearing the mask, because remember, particles can spread very easily. So it's not the fact that we need to wear a mask to prevent us from getting the virus itself. It's more of our preventative aspect, where persons are encouraged to ensure that they would have taken their vaccines and are covered with the measles vaccine, so prevent them from getting the virus itself. Yeah.
So, okay, the vaccine, we're going to put a thumbnail on that. We still do vaccines for the children. That's where in not primary school, that's the babies. The babies will get the measles vaccine.
We give the measles vaccine, or the MMR. Once ago it was just the measles. Now it's a combination of the measles, mumps, and the rubella. So we give that vaccine at 1 year or 12 months. So it's 12 months or 1 year. And then that's the first dose. The second dose is given at 18 months or a year and 6 months. So those are the 2 doses that must be given to the children so that they are covered with the measles.
You said
virus.
It was measles, mumps, and rubella. Are those classified basically, are they similar? The virus is similar? That's why they combine it like that, or?
Somewhat, more or less, yes.
Okay.
Yes, more or less.
So then,
there are some similarities.
I have a few questions, but I mean, I'm going to, obviously we'll elaborate as the show goes on. I will also let you elaborate on your slides as well. But in terms of initial symptoms, like, is it like you're going to have a flu? How is it like the regular virus pathogenesis that we'll see in measles, or is it tricky to figure out, especially in babies? You know, children always get fevers. It's not a cold, it's not a cough. So is it achy joints?
As you said, babies always get, fever, cold, and a cough. So with the measles, you generally have those similar symptoms. You have what we call the flu-like symptoms. So there's a cough. You do have a cough. You do have what we call conjunctivitis, or red eye, pink eye.
We're going to stick a thumbnail on that. We're going to take a quick commercial break, and we're going to elaborate on those symptoms, because I never knew that. I never knew that. We'll be right back.
That's what I'm talking about.
Wait! Okay, now, from the beginning.
No.
Hit it, boys.
Welcome to the Sinkers Craft House. This is where life begins, and what we create will leave you speechless. We train, we create, we promote, and we maintain the highest standards. Experience life for yourself. The premier craft and production facility in St. Kitts and Nevis.
I hope you're ready for what's coming now. I'm the one, I'm the lady that will bring it down.
Go to slide 1, 2, 3, 4, 5, 6 has the signs and symptoms.
So the one before that was. So the topic for today, or this evening, is the risk and communication of the measles virus. And with me I have the lovely nurse Nikisha Hazel of the Bastille Health Center. She's the deputy coordinator for community nursing. And we are now having a very much timely discussion on the measles, because there's been a recent resurgence of the virus, and we just really need to make sure that the members of the general public are aware of a possible, it's not necessarily an imminent threat, but there's possibilities, and we need to make sure that everyone knows what could and could not go wrong, possibly, if we should ever see any outbreaks here. So you were saying we're going to elaborate on the signs and symptoms. That's slide number, what slide is this one? Number 4?
6.
Can we have
6
slide
signs
number
and
6?
symptoms.
Signs and symptoms. So yes, we'll elaborate.
Yeah, that's one.
So you were saying you can have
So you can
conjunctivitis.
have a cough, conjunctivitis, or pink eye, red eye, that most persons may know it as. And of course, you can have congestion or runny nose. But the two main features or symptoms are usually the fever and rash. So you're looking for a fever and rash. Most of the time, you will get the fever and then you will get rash afterwards, sometimes.
How long does the fever last?
But fever could last, it depends. It depends on the individual. 3 to 4 days the fever could last, and then the rash begins to appear slightly after, give or take 3 to 4 days. And persons can, one thing to note though, that persons can actually have the measles virus and of course not know and spread the virus.
That is what I was getting
so
at.
That's
what we need to
four
talk
days
about.
before 4 days before any symptoms appear, you can actually have the virus.
So that's the incubation period from the pathogen, the entering into the body. You have 4 days that you're just out and you don't know.
You're not aware that you have the virus. And of course, 4 days after the rash would have appeared, you're still able to infect others. So you have that
so
period.
Scary because then when you think about children and they're going to school, they're going to be playing, they're going to be jumping around, they're going to touch each other. The place is hot, everyone is sweating, and then there is this, it can be communicated to sweat, like it's bodily fluids. So if you're sweating, it's in a generally open environment where you have lots of kids. That's why I found it a bit off-putting. If we should have an outbreak, like it's the babies for me.
Yeah, you make a valid point there, because children tend to, they're always in crowded areas. There's a group of them.
They like to bunch up.
They love to play, and a lot of times they would have a cold or a cough, and you see them would wipe their faces, and they go ahead,
and
continue to play. They touch everything, and then another child comes, and so they are very much at high risk. Children, so anybody can get the measles virus, of course, but children are at high risk for contacting the measles virus, and of course our elderlies, because of their immune systems, may be at lower. So children are very much at risk.
I know, for instance, for dengue fever, the rash would be on the trunk area, the back, and it's like a yellowish kind of, almost look like a jaundice sort of presentation, but for
with the measles, the rash usually appears in the face. So it usually begins in the face first, and then it spreads downward towards the body. So it's going to look like
psoriasis or eczema?
It's more like eczema. So it's like some red patches, and then there's some whitey spots would appear on top of those red areas. Yeah.
So is it something that, I know some rashes can present like lesions, you can have oozing of fluids. Is it that sort of rash?
No, it's more of a dry rash. It's more of a dry rash.
All I wanted to know.
And it's very itchy, so it's more of a dry rash, and it could be very itchy, especially for children, and they tend to scratch and scratch. Yeah.
That's
so
a nightmare.
it could be very itchy. So those are the signs and symptoms.
I think that the early childhood education need to take note of these things, because they need to be paying attention.
Well, I must admit that we have been engaging with the early childhood, and we have been doing some teaching sessions with the preschools and the daycares. Yes, we have begun. Yeah.
Awesome. So they've been. Do you think they've been collaborating with parents as well to be looking out?
Yes. So I know that some schools are actually having meetings where they invite the parents in, and nurses go in and have a discussion about measles. So that's presently happening.
That's awesome. So
yes.
Would you say parents right now have been receptive? Are
yes.
they interested? Are they scared?
A combination of feelings. So you have some persons who would be scared because this is something new to all of us. And they have those who are interested and want to know more. And of course, you know, you're going to have those who are not really here or there. But we have been getting quite a bit good interaction as it relates to the early childhood department. Yes.
I think I like where that is going. That gives me a sense of a sense of ease, because I was I was having a mini panic in my head, because I'm thinking, like, how are we going to collaborate? How are we going to get people to understand? How are we going to get people on board? Because as simple as that sounds, it's actually quite a task. Even if something is in the best interest of the public, we have to convince them why it's in their best interest to know these things, and that's a challenge sometimes.
Yeah.
So we have the rash. There's a fever. The first is a fever, and
fever and rash, usually that's the first, you know, two things that we look for, and because it's the two most common symptoms as it relates to measles. When you see measles, you see fever, rash.
How long does the rash last?
It varies, and it depends on the child or the individual. There's not a specific, you know, it could last a week, it could last, you know, 3 weeks. It just depends on the individual.
So
that's just an image of how the measles would look,
almost, like,
especially
if you're not paying
somebody.
attention, I think, especially in this time, that looks, you can almost not recognize it right away.
Yes.
That's what I'm thinking. Because even with
can
this
have
heat,
some misdiagnosis, and
it's
you
almost
know,
looking like, almost like if it comes on around the neck area, it can look like a heat rash.
yeah.
Wow, that's very scary still, though. Okay, so we'll carry on. So the fever, the rash, so then that's basically, and then if we have those symptoms and we take the child to a health professional, what can we expect? Is there a measles test? What do they do?
Yes, so there is a test that can be done. Of course, you have a blood test, you can have a urine test, and you can also have a nasopharyngeal swab. Those are the three tests that can be done as it pertains to measles.
Nasal swab.
And of course, contact tracing, if it's suspected that the child would have measles, there will be contact tracing. So persons the child would have been around, whether at school or at home, within the family itself.
Okay. Oh, that's very extensive. So I suppose if there's someone in the household that potentially contact, it's going to be almost like that COVID thing. They're going to have to
Similar, yes.
They're going to have to have social distance, and the person going to have to quarantine in a section of the house and stuff like this?
Yes, some similarities as it pertains to COVID. And we must realize, especially when we speak about COVID, that quarantine is nothing new. I guess it's new for us because of COVID, but quarantine is something that has been going on for quite some
It's bringing
centuries.
back very mixed memories and
Yeah.
mixed emotions about quarantining and social distancing in your house and what's not. And if you are a parent with lots of more than one child in the household, I could imagine how keeping children apart and not playing and interacting, I don't know how that's going to work out. I suppose that the presentation is different in babies than it is in adults.
Sometimes, yes. And if you recognize, I said fever and rash with the babies, and with the adults, sometimes, you know, you get like our cough, cold, you know, something of that sort. With the fever, you get congested, and you think maybe it's just the flu that I'm getting. And you may or may not develop other symptoms.
The conjunctivitis was surprising for me. So you would see that across the board with most patients, or is it just children, or is it adults who get conjunctivitis?
Both adults and children can get conjunctivitis. It just depends. You know, with individual symptoms appear differently.
And for FYI, conjunctivitis is what the layman's will call
You say red eye, yeah.
And conjunctivitis can be either bacterial or viral, but in this case, because it's
virus.
it's going to be viral, and so the
yeah.
presentation would be slightly different. Like the treatment of viral conjunctivitis is different. With the bacterial one, obviously you will take antibiotics, but do we have an antiviral for the measles? And we're going to stick a thumb in that, and we're going to take a okay, sorry, it's not time for a commercial break yet. I misread my prompt. So we have an antiviral, we have medications. I'm not going to put you on the spot. I'm just speaking in general. We don't have to, it doesn't have to be for our nation. I'm not going to try to ask you if we have them on hand, but is there a medication, generally speaking, like an antivirus?
So generally speaking, there's no medication or treatment per se for the measles. However, measles, when you think about measles, you're treating the condition surrounding
so you're basically
presentation.
Symptom management?
Yes.
So
based on the
symptoms, run the
symptoms, yes, the virus has to run its course. Yes, the virus has to run its course. Our best bet is to be vaccinated, to be covered with the measles, mumps, and rubella vaccine.
You know, like this is sounding like dengue. Dengue, you know, has to run its course. There's all you have to do is have fluids and
yes,
basically pain management.
Pain management, rest
until the pain decides if it
Subside.
decides to go. So is it a painful thing? Is it accompanied with headaches and stuff? Is it muscle joint pain, anything like that?
No, not generally, no. But as I said, people present differently. So some persons may have different symptoms and different signs that appear individualized. But generally we look at like a flu-like symptoms, person feeling weak and lethargic, you know, like they have a flu, a cold, cough, runny eyes. It just keeps you...
So it can almost look like an allergic, like allergies or something, like the itchy eyes, the runny eyes, because I know of some persons, they came down with conjunctivitis and they thought it was allergies. They were not. They didn't realize they had a viral infection in the eye, because it wasn't going away and it was becoming more infected looking and swollen. So, for the symptom management, you would treat the conjunctivitis basically the same way you would treat viral conjunctivitis. So it's symptom management. So you basically have to be treating each individual symptom for symptom relief.
Yes. So whatever symptoms appear, then that will be treated, the symptoms. But the measles virus, there's nothing that I can say, okay, doctor is going to prescribe this and I'm going to go home and I'm going to take it for a week and I'll feel better. No.
We're going to stick a thumbnail and we're going to take a quick commercial break and we'll be back.
It's time that we...
Where are we now?
It's time that we realize that we must work together to thrive. Move our lives, we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing.
But hope is remaining.
And we can't ignore the future, it depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live, permite a todos vivir. Tomamos la oportunidad, vanguarda la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
We never know when a storm may strike, but we can be prepared. At Scalec, we work tirelessly to keep our customers connected. When a storm is approaching, we activate our hurricane preparedness and response plan. After the storm, our response teams will assess the damage to our network. If you are daring enough to go outside after the storm has passed, don't touch any downed power lines and stay clear of sparking wires. We'll need you to remain patient as some restoration work may take longer than others. Before restoration work begins, we will fix any damage to our power plant and transmission lines. Then we'll restore power to priority areas, beginning with essential services like hospitals, police stations, and water pumps. After that, we'll restore power to the largest number of customers on one feeder, which will take the shortest amount of time. We will then restore power to smaller feeders and individual customers with isolated problems. Be sure not to worry. Skelec is right here with you when you need us most.
That's what I'm talking about.
Wait!
Okay, now, from the beginning.
Hit it, boys.
Welcome to the Sinkers Crap House. This is where life begins, and what we create will leave you speechless. We train, we create, we promote, and we maintain the highest standards. Experience life for yourself. The premier craft and production facility in St. Kitts and Nevis.
I hope you're ready for what's coming now. I'm the one, I'm the lady that will bring it down.
And welcome back, viewers. I am your host, Dr. Monique Lescott, and I am here with the lovely nurse, Miss Nikisha Hazel. She works at the Bastia Health Center, and she is the Deputy Coordinator for Community Nursing. And we welcome you guys back again for our elaboration of the discussion. Our topic tonight is the risk and communication of the measles virus. So we were speaking about just now, it was the symptoms and basically how we would go about identifying how to do symptom management, because there is no cut and dry cure per se, but that's actually most viruses. A lot of people don't realize that a lot of viruses actually don't have a cure. Yeah. It basically has to run its course, which means that you have to treat the virus by making sure your immune system is up to par and you're helping your body to fight. So we're going to move along, and we're going to speak about now the complications of measles, which actually can border on very serious sometimes. So yes, I'll let my expert nurse elaborate first.
So there are some what we call complications for persons who may contract the measles virus. We have complications such as ear infection or otitis media. There's also blindness. Oh. Yes. These are some severe
I didn't see that one.
Yes, there's also blindness. There's also encephalitis, which is infection of the brain.
Yeah.
And also we have diarrhea, severe diarrhea, and pneumonia as well. And febrile seizures, especially for children. You know, children tend to have febrile seizures with certain conditions. So with measles, these are some of the complications that would arise for persons who may contract the measles virus.
That's really, really serious, especially pneumonia. Pneumonia can be pretty tricky to treat at times. And I would think if you contracted measles, you would probably have the community-based pneumonia, which is different from if you get pneumonia from the hospital, but it's still kind of tricky to treat, especially if you're going to be treating like multi-symptoms. For instance, encephalitis is an extremely, extremely difficult complication, especially with children. I've seen children with encephalitis sometimes even forgetting how to speak, forgetting how to walk, forgetting how to do basic neurological functions. Like encephalitis can be very debilitating for children especially. I can't even imagine for elderly people. And one is it you can also develop respiratory complications as well?
Yes, because remember, measles is a virus that attacks the respiratory system, basically. Yeah, it attacks the respiratory system. So these are some of the reasons why they would have these sort of complications. And of course, another complication which I didn't mention is death. With everything, of course, persons, 1 in 3 persons or 1 in 3 children can die from having measles itself.
Reason being because we have a high population of children and adults with asthma. So that's why I saw it as a huge red flag. So that's why I was asking about in the beginning if you're going to have flu-like symptoms, because sometimes those things can flare up an asthma attack or exasperate if someone already has an existing respiratory illness,
condition,
right? So I found it a bit concerning, especially, for instance, there is no antiviral for it, and you basically have to treat the symptoms. So if you're going to, is it that you're going to have like buildup in the lungs? Do you have phlegm? Do you have, like, for instance, some asthmatics can have, crackles and stuff. If I were to listen to it with my stethoscope, is it that the person will have fluid buildup in the lungs and stuff? Is it like the physiological finding? If I were to do a physical exam, they're going to have crackles and stuff?
I guess most in the latter stages, but not initially, because more of the symptoms is based around swelling and congestion.
That's what I mean. So you're going to have inflammation.
So you may
so
have,
that's why I was wondering if you're going to have mucus buildup and
you
stuff.
may have some mucus buildup, of course. Depends on the symptoms that appear for that individual.
I am so concerned for children with asthma now, because because we know that sometimes the mucus and stuff sometimes is why we have little complications. So then if you already have a pre-existing lung issue, then I could imagine measles can mean
exacerbate.
That means you're very much on the brink of being one of those 1 in 3 people. Well, that is very, very concerning, and I'm happy that the ministry has reached out to early childhood development to collaborate so that parents can extend their vigilance a bit more, because heaven forbid we have one of our children with such an issue. When they go to the emergency room, the parent might not be able to explain exactly because they might not even be aware. So then it doesn't really give the doctors much to go on to work with. Wow, that's very, very scary, actually.
And that is very important. It's important for us to educate the parents so that when they are at whether the health center or the hospital, they're able to express and say, okay, this is what happened. This is what happened around this time, and then this began at this time, that kind of stuff. Because if they're not aware, then they just take it for granted that, okay, that happened, but not recognizing that this is something important that I need to tell the doctor that happened.
Of course.
So it's important for us to, educate the public, not just parents, but the public, of course, so that they will be able to identify the condition and be able to give a good history.
The history is very
important.
Like,
yes.
I'm just thinking about it now, and I could imagine just even if you were to maybe miss a small detail that can lead to even further complications down the road. I could only imagine. So where were we? We were speaking about the complications, the encephalitis. We don't have, for instance, the drugs and stuff needed to treat encephalitis can also be very tricky. Our pediatrics department will definitely have to put all heads together for this one. And the ear infection, I guess we will treat that just like any other ear infection, like a viral ear infection. And the blindness, I would really love to explore how come, like why that happens, but I know that's a forum for another time. So we are saying here that children 5 years old and adults 20 and over are more likely to suffer from these complications. That's exactly what I was suspecting. I thought it would have been the children and the older adults would have been the more vulnerable of the population.
Yeah.
Okay. And the long-term complication here, can you pronounce, this is SSPE, and my lovely nurse, can you pronounce this word for me? Subcutaneous, what? I won't even try to pronounce that long word.
Subcutaneous sclerosing pancreacephalitis.
Like, I don't know, I've never heard of this one, but I'm praying that none of our young people ever have this. We're going to take a short commercial break, and we're going to elaborate a lot more when we come back.
It's time that we It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see, and the climate's changing.
But hope is remaining.
And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
"35-year-old Gerard Boone is an orderly at the Joseph N. France General Hospital. He's a graduate of the Virchals High School who traveled to England to further his studies. He started working in the medical field as an orderly on the psychiatric ward in 2020. Gerard works closely with the nurses and doctors assisting patients by making sure they're comfortable and in good health. After 4 years, his passion for his work at the JNF hospital continues to grow, and he feels this is where he can make his contribution as a productive citizen of this country. Kudos to Gerard for his dedication and a job well done.
And welcome back, viewers. My name is Dr. Lescott, your host, and I have with me the lovely Miss Nurse Nikisha Hazel of the Bastyr Health Center. She is the Deputy Coordinator for Community Nursing, and our topic for this evening is the risk and communications of the measles virus. We decided to collaborate on this topic because of the recent, I would say, a recent resurgence after being eradicated of the disease in the region since the early 90s. We've apparently learned of new imported cases in, was it the Turks and Caicos, which is still very much in our region, and it's something that we need to look out for and be vigilant about, because the Turks and Caicos is in our region. So if they got an outbreak or found cases within their island, then we can assume that maybe it's only a matter of time before the virus sees its way into our shores and our federation. So we must be on our guard and have the available information on hand so that the public can be prepared. So we're going to move on with our topic, and we're basically going to differentiate the difference between the virus in how it presents in children and how it presents in adults. And I'll let my expert nurse again take the floor with that one.
So as Dr. Lescott stated that we have eradicated the virus since early 90s, and because of this case in our region, it's important for us to educate persons as it pertains to measles. Not just educate, but also encourage persons who may not have had their vaccines, whether the 2 doses, to go out and get your vaccines, be vaccinated as it pertains to the measles virus.
2 doses. So
2 doses. So
how does it go? So you take 1 dose and then you have to come back. How long?
You have to follow up within a month to take your 2nd dose if you've never been vaccinated with the measles virus. But for children, they are usually given the 1st dose at 12 months or 1 year, and the 2nd dose is usually given at 1 year and 6 months.
Okay, so the majority of our islands, children, but I guess they would have a few in between that might not have
Yeah,
been
they may have a
vaccinated.
few in between who probably would have missed, or because of some other reasons, we're having little pockets of persons who are refusing the vaccines now. Not many, because we're generally, at a 95% and above as it pertains to our rate for our vaccines, which is very good. But, there are some little pockets out there of persons who still have their, doubts
The
and
reservations. What are some of the
skepticism.
concerns that you've heard parents voice about the vaccine, though?
One of the major concerns parents would voice is the fact that the measles vaccine would cause autism. I think that's one of the major concerns for those little pockets. But besides that, then you have to deal with the Rastafarian religion personnels. So those are all little pockets that we need to.
So it's
that we
basically
are,
some are concerned
working
that
on.
it might have adverse effects, and others it's because of a lifestyle choice.
Lifestyle choice,
Okay.
yeah.
I understand.
Yeah. So we have those little pockets that we are working with. Because we can only continue to educate and promote.
I understand. I definitely
And
understand.
as it pertains to the difference with children and the male, the symptoms of measles are generally similar in both children and adults. However, it can be more severe
In children?
for the adults.
For the adults?
It can be more severe for the
Really?
adults.
Wow.
yeah.
And all this time I was just really
For
concerned about the children. It's the
High
adults.
fever of 104 degrees Fahrenheit. You have a cough, almost like a persistent dry cough. They can have that. And also runny nose or nasal congestion. And the couplet spots, which are small whitey spots inside the mouth, the lining of the mouth.
Almost looking like thrush.
Yes, almost looking like thrush. Yes, so you
Are
have some
they
small whitey spots
painful?
inside. It can be very painful.
So it's
yes,
like a
because
blister.
if you're going to eat, it's going to be difficult to be chewing and rubbing on the lining on the inside. So it can be
So
uncomfortable.
it's basically a blister almost, like in the mouth, because it's going to make the lining of the mouth more vulnerable now.
Open, yeah.
So it's like lesions.
Kinda.
Oh, I did not know all of this.
Yes.
Okay.
Yes.
And
of course the rash on the face that spreads downwards throughout the body.
so it starts,
It starts at the face.
it starts at the
Yes,
face and it
based
doesn't
on-
stay there. It actually spreads
It spreads downwards the body. Yeah, it starts on the face and spread downwards the body.
I feel like this measles come for blood.
Yes. And adults can have high risk for complications such as pneumonia, encephalitis, and hepatitis or liver infection.
Really?
Most of us know about hepatitis, but there's increased complication for the adults.
I did not realize that it was correlated with the measles infection, that you can have liver failure, basically. That is
Yeah.
really, 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 really serious.
Yes. It lasts longer with the adults. It takes longer to recover. And the symptoms are more severe and last longer.
Like,
So
I'm
it
trying
stays
to
longer
figure out,
to
wow,
recover
like,
pertaining to adults.
that's a whole, like, that's almost the only organ system that was not mentioned is basically the kidneys and the heart, because it can affect your eyes, it can affect your brain, it can affect your liver, which is one of your major organs of waste disposals. So, I mean, I guess it wouldn't get as serious as liver cirrhosis, but a liver infection is really still very serious and very complicated to treat. Interesting.
Yes. So those are some of the complications that adults would have to deal with in terms of measles. Generally, some persons will get the measles because I've come across a few adults, in their like 60s and 70s, who would have said, "I had the measles before and nothing happened to me," As a
Really?
child, that would be as a child. They would have said, "Oh, I had the measles before and nothing happened to me." That's good. That's really good. But there are some complications that can happen as it pertains to the measles virus.
I find that is so disconcerting. Like, I was not expecting all of those things. So in terms of the adults, they really need to be more hypervigilant and even pay attention, because I guess the blindness, that would be like an end stage something. Does it go in stages, or is it that these symptoms can happen haphazardly and randomly?
That's something that's quite interesting, because because of the condition and I guess the stages that it goes through, then these are some of the complications that can happen in the end of everything.
And of course, blindness cannot be reversed.
No.
Once you're blind, you're just losing your sight. That's it.
Yes. And these are complications that we don't want anybody to have to go through. Absolutely no one.
And and here it's saying that it's more contagious in children.
Yeah.
Okay, so, all right, so we're going to stick a thumbnail. We're going to go to our, what's this? This is the Director of Health Services. We're going to have a word from Dr. Morton.
Good day, I'm Dr. Jensen Morton. I'm the Director of Health Institutions, and today I'm here at the Joseph and France General Hospital, and specifically at the Emergency Department. Now, whilst over the past few months we've been making much progress with regards to different areas in which we've been able to improve the health services being offered at the institutions and in the Ministry of Health on a whole for St. Kitts and Nevis, if there's one area that people still have some complaints about, it pertains to the wait time at the JNF General Hospital. We are not deaf to the pleas of persons regarding complaints about same, and we'd like to announce to the general public that we have taken some steps with regards to the rectification of this issue. One of the first steps which we've taken is the hiring of 5 new individuals to specifically serve as triage officers, fully employed in the emergency room. So a triage officer is a person that deals specifically in the emergency room for the ambulant cases, to be able to determine which cases are urgent, which cases are emergent, which cases are non-severe, etc., which can help with the ordering in which persons that are suffering from ailments that are a little bit more serious to be seen a little bit faster. Now, we do have triage already in the hospital, but one of the things it suffered from was that it's not a 100% dedicated service. So sometimes the officers that might be working might be pulled to the back part of the emergency room to try to deal with certain cases when the numbers get high. This triage service that we're offering is going to be a fully dedicated service to work in the emergency room alone. We have some other things in store. One of them will be a public education campaign, such that the general public is a little bit more aware of particular conditions that can be treated at home and the proper ways in which that can be done. And as well as the proper signs to look for, which will determine whether it needs to be reviewed by a medical team or not. And it's also going to be with regards to more signage in the emergency room so that more people are aware of what constitutes a genuine emergency versus what constitutes something that might have to wait a bit before it's seen by the emergency team if there's someone else more emergent than you in the queue. So we are trying our hardest with regards to decreasing this problem that we are having at the emergency room and at JNF General Hospital. And we are hoping that the general public can appreciate the changes that we're instituting. So to conclude, we'd just like to reassure the general public that we at Joseph and Franz General Hospital, that we are looking into this concern. And it's a work in progress, but we do eventually think that we'll be able to genuinely step up the quality of care that patients are able to receive in the emergency services of the hospital. Thank you.
We never know when a storm may strike, but we can be prepared. At Skelec, we work tirelessly to keep our customers connected. When a storm is approaching, we activate our hurricane preparedness and response plan. We monitor the storm and work closely with the authorities. We'll need you to ensure that there are no trees in the lines near you. If you need our help, call us for more information. It is likely that there will be a power outage, so make sure all your devices are fully charged. If you have a generator, make sure the changeover switch works. Ensure you have enough fuel and that your generator is isolated from the grid. It's best that you power off your main switch from the electrical panel and unplug all appliances. When calling to report faults, tell us everything. Don't leave any information out. After the storm, our response teams will assess the damage to our network. Be sure not to worry. Skelec is right here with you when you need us most.
Join us on ZIZ TV for Youth Lounge with Skenaipel, a talk show on vital topics such as tourism, entrepreneurship, education, religion, sex education, and mental health, featuring experts from St. Kitts and Nevis and the Caribbean region. Tune in live on the first and third Wednesday of every month at 8:30 p.m. on ZIZ TV.
And welcome back to my viewers. My name is Dr. Lescott. I'm your lovely host, along with Miss Nurse Nikisha Hazel of the Bastyr Health Center. She is the Deputy Director of Community Nursing. So we're just going to have a review and a recap of what we were discussing before, and the topic for this evening was the risk and communication of the measles virus. So we're going to have a recap of what we've been discussing. I'll give the floor to my lovely nurse.
All right. So this evening we were talking about measles. What is the measles virus? So the measles is a highly contagious virus. The measles is spread through cough, through airborne, basically. So if somebody coughs, somebody is singing, somebody, just by even me speaking here, and if there's, persons within the room, it can spread up to probably 12 to 18 persons. The virus can be spread to. So it's very much contagious. And if you're going to compare it with other conditions such as dengue, maybe hepatitis or Ebola, or TB and things like that.
By the droplets.
Yeah, tuberculosis can be spread by droplets. But however, it pertains to the person being within the environment and how often and how long they are within that environment with the TB, tuberculosis.
Like for instance,
but with measles,
I forgot to ask you, because with TB, certain areas of the body are reservoirs. Is it the same for measles? Like for instance, with TB, the back of the throat and up in the nasal area can be pretty potent areas for the colonies of the virus to live. Is it the same as measles?
Yes, it's basically similar, the same, yeah.
Oh.
So, you can catch it through your mouth, your eyes, and your nose, of course. because it's airborne, it's spreading, and droplets also on surfaces. It can stay on the surface for up to 2 hours, so it's very contagious. And we know that children are very much high risk of contracting the measles virus and also spreading the virus itself as well.
But something I didn't ask, like if someone dies from it, some diseases, the person is still contagious even in death. I think for HIV, it's like 48 hours after death, the body can still be contagious. Is it like one of those things as well with measles?
No, I don't think so. No. I don't think, no.
I'm so scared. I mean, I'm asking all of these questions because I'm sorry, they're just popping in.
So the virus can spread 4 days before you actually show any symptoms of having the disease, and 4 days after the rash appears. So 4 days before, you're not knowing, so between 10 to 14 days, you can be infecting others.
How many people? Oh my
others,
gosh.
and you're not even aware that you're infecting others because you don't even know that you have the virus. Yes, so that can happen. And as it pertains to measles as well, there are some complications. We have things like ear infections or otitis media. We have diarrhea, severe diarrhea complication. We have pneumonia. We have encephalitis, which is inflammation of the brain. And we have things like, I think I said pneumonia already. Encephalitis, blindness is another complication that can happen with measles.
And a really, really long word, that SS, that I could not pronounce for the life of me.
And of course, with when compared children to adults, the virus is more severe in adults compared to children.
Wow. I heard
it's more
something
severe
because
in
I was
adults
almost thinking that it was going to be
children.
more severe in
the children.
And not, so I had it turned
Yeah.
backwards. Okay. That was a very interesting talk, and I would really like to take this opportunity to extend a really, really heartfelt thank you for having you come here and share your expertise on the topic. We really appreciate you, and I hope I can get you to come and share your knowledge again on maybe another topic and another time. It's almost time for the show to be over, but I do have one last segment for you, which is a new segment. We're going to have like a health tip. And my health tip for you guys would be, with this hot weather and the heat wave, is for persons to take in consideration their hydration. Make sure you're drinking enough fluids. It's not even just about drinking enough water. It's about making sure that you have enough electrolytes. One tip that I can also give persons who might not have a working air condition in their home, you can simply just damp a rag, place it in your freezer, and you can place on your head or around your neck or about the body to prevent your body from becoming overheated. And as well, I would implore persons of different communities and villages to check on your neighbors, the older people who can't move around, the shut-ins, the ones that are inside these houses. If it's so hot for you who can get up and move around, imagine those persons who are bedridden, who don't have anyone to maybe check on them, who might be living alone. Please check on the elders around this time of the year with the heat and the heat wave. So my health tip of the night for you guys is to stay hydrated and to check on the shut-ins, the elders of the community, and to also make sure that they're adequately hydrated as well. And that is our show. Thank you for watching, and I do hope that I can be here again as your host for our next show next time. Thank you.